Hi, I'm Sarah Bass. I'm a faculty member in the College of Public Health at Temple University in Philadelphia, and I run the Risk Communication Lab. At the lab, we use some of the same techniques marketers use to sell you things, but we're trying to figure out how people make decisions about their health. We use things like segmentation, which is when you take a group and divide them into smaller groups by how they might think about things. And then we use something called perceptual mapping and vector message modeling, which create three-dimensional maps so we can understand how best to move people towards a certain decision. To show you how we do this, I want to talk a bit about one of our studies that looked at how people in Philadelphia felt about getting a COVID-19 vaccination. This study was published in the Journal of Health Communication in 2022. COVID-19 vaccinations are key to stopping the spread of the virus, but there are many people who are hesitant to get vaccinated. We wanted to see if how trusting a healthcare provider and if having had COVID-19 or knowing someone who was impacted by COVID-19 would affect how people felt about getting vaccinated in those who were already hesitant. This is important to understand, so we better communicate with hesitant groups about COVID-19 vaccination. We surveyed 110 Philadelphia residents who had not been vaccinated for COVID-19 and were hesitant to do so. Then we did segmentation analysis by separating them into three groups: people who had high trust of healthcare providers but felt they had not been impacted by COVID-19, people who had moderate trust of healthcare providers and had high impact from COVID-19, and people who had low trust of healthcare providers and low impact from COVID-19. Once we did this, we used perceptual mapping and vector modeling techniques. This sounds fancy, but it's really not. We use the answers from the survey, and then the software we built turns those responses into a three-dimensional map. That map shows how different ideas or feelings are connected and gives us a look into what's going on in the minds of the people surveyed. We can also create maps for the different segment groups and do what's called vector message modeling to figure out how exactly to move a group from not willing to be vaccinated. This process is similar to what you might remember from high school physics class, figuring out how much force needs to be put on one object to get it to move towards another object. You have to push and pull to do that, and that's what we do in the map. We figure out which statements would need to be pushed or pulled on to get the group to move to the decision. This helps us focus on just those things that matter most to persuade that group, so the message really hits home. It also lets us compare between groups to see if messages are different, allowing us to really customize messages based on how a group feels. For this study, we ran perceptual maps and did vector message modeling for the three groups, and what we found was eye-opening. This graphic shows how different the three groups rated the different statements about COVID and the COVID vaccine. And you can see that not only are they different, but the intention to get vaccinated for COVID-19 was very different. The group that had low trust of healthcare providers and felt they had not been impacted by COVID-19 were much less likely to say they intended to be vaccinated. When comparing the perceptual maps, we see that there is some general agreement among the groups, showing that everyone needed messaging that addressed beliefs about COVID-19 being a hoax, and that minorities should be suspicious of government information and are used as guinea pigs in research. But there were also important differences. For example, when talking about the COVID-19 vaccine, those who had high trust and low impact need messages about side effects of vaccines, while the moderate trust and high impact group would need to have vaccine safety issues addressed. The low trust and low impact group would instead need messages about their distrust of pharmaceutical companies who produce the vaccine. When it came to beliefs about COVID-19, other differences included that those with high trust and low impact would need messages about the belief that COVID messaging kept changing and it being a hoax, while the moderate trust, high impact group needed messaging that acknowledged the belief that minorities were not getting the same treatment, that they should distrust government information, and COVID-19 was man-made. The low trust, low impact group needed all of these things addressed. So what does this mean? It means we can't take a one-size-fits-all approach, and that vaccine hesitancy is driven by more than just someone's demographics, like their race or gender. Instead, it could be better explained by how much people trusted healthcare providers and how much of an impact COVID-19 had made on them. This study showed that how you communicate with people may need to be tailored to these things. Many of the media campaigns about getting vaccinated for COVID-19 have focused on personal responsibility and protection of others as reasons to be vaccinated. What our study showed is that neither of these things would be persuasive in people who were hesitant to be vaccinated. Instead, a more community-based approach might be necessary, where messages are provided by peers who endorse vaccination and who are also similar in how they feel about trust of healthcare providers and the impact COVID-19 has had on them. Bottom line, messaging about COVID-19 and vaccinations may need to be different to really persuade people who are already hesitant to get vaccinated. General messages just won't cut it. They end up being too watered down to really work for anyone. That's the power of using segmentation, perceptual mapping, and vector message modeling. They help us get really specific so we can design messages that actually move people to action. Thanks for tuning in. If you want to learn more about what we do, check out our website and follow us on social media to stay updated on our latest projects.